Hello and welcome to the Modern Healthcare Podcast, bringing you conversations, ideas, and practical strategies to help you thrive in your healthcare career. To kick off today's conversation, here's your host, Diana.
Welcome, everyone, to the first episode of our podcast, The Modern Healthcare Lab. Today, I'm very happy to be joined by Dr. Karen Jacobs, who is an occupational therapist, educator, and researcher with more than 40 years of experience in the field. She's a clinical professor and program director at Boston University Surgeon College and has been a global leader in occupational therapy, ergonomics, and workplace health. Dr. Jacobs has held leadership roles in AOTA and has received numerous honors for her contribution in the field. Welcome, Dr. Jacobs. It's great to have you here.
Thank you so much for having me. I'm delighted to be on your podcast.
So I'm going to start with the first question that I have for you, and which is a basic one, the most essential, I would say. What first inspired you to become an occupational therapist?
Well, I love that question because I have to say, when I was in undergrad school, I never heard of occupational therapy. So I'd like to share the story of how I was introduced to occupational therapy and why going into it as an entry-level master's student really inspired me. So a long time ago, at the beginning of my formative time in my early 20s, I also was a craftswoman and went to many different craft fairs where I would sell the leather and ceramic work that I did. And at one craft fair in St. Louis, Missouri, USA, I was set up next to a potter, someone who did ceramics, beautiful work. And I walked over and said hi. It was a mother-daughter team. And the daughter was sitting reading a book, and it was an anatomy book. And I said, why are you reading a book on anatomy? And she said, well, I'm studying to be an occupational therapist. And I said, of course, what is it? And she explained, and it just opened up sort of a light for me, saying, this is the profession I was looking for. The idea of meaningful occupation, whether it's caring for yourself, creating pottery or leather, taking care of a child that might have a learning disability, that I learned that meaningful occupation was central to health and well-being, and that resonated deeply with me. And it offered to me a way of working with people to help them live their life to its fullest. So after the craft fair, we went to her anatomy lab, spoke more and more about occupational therapy, and I said to her, this is a profession that I need to go into. And so I explored what it would mean with my bachelor's degree in psychology and preschool primary education to go into occupational therapy. And we were going to be moving at the time to Boston from St. Louis. I explored, what I needed to do and applied to Boston University and was accepted in 1977. And I have been so grateful to be at that art fair and to have met Michelle, who inspired me about occupational therapy.
What a beautiful story. And at the same time, it made me think how these maybe small moments, I would say, make these huge shifts in our life. And what a beautiful shift it made in yours and everyone else that learns from you. And it leads me to the second question, which it is also related to this, what you just told us. So this was a moment that it helped you shape your profession and or like starting it. And what I want to know is what were some other moments that later shaped the professional, the educator, and the leader you are. So maybe similar moments as this one, just seeing someone in the fair, learning about OT, and then choosing to pursue this.
Yes. Well, when I became an occupational therapist, I was a single parent at the time. And so I was juggling being a mom and having graduated from Boston University. And I started working at a school at that time that was called the Little People School. And I was asked to work with children that were transitioning into being teenagers and help them develop pre-vocational or work skills. The program was very successful, and the school decided to expand to a high school, and it became the Learning Prep School, so using that same, abbreviation, LPS. And at that time, the director of the school said, your occupational therapy program was so successful in working with these children who had learning disabilities. Would you be willing to help create the vocational high school? What an amazing opportunity. And so I did that. And as I was doing it, I somehow, and I'm not even quite sure how that happened, a publisher, Little Brown, heard about what I was doing and asked me to write a textbook about, occupational therapy and work-related programs, and this program that I had the opportunity to create. And that was remarkable. I think some other pivotal moments in my career were that I wanted to get involved on a national level and ran for work program special interests section, being part of that led to running for vice president of the American Occupational Therapy Association, and then being president of AOPA. And that gave me sort of a broad US view of our profession, its strengths, its advocacy needs, and the extraordinary people that I got to meet. It was remarkable. Another pivotal point in my career that I never expected to obtain was being an Eleanor Clark Slagle lecturer in 2012. And that was deeply humbling, but it pushed me to try to understand messaging in occupational therapy and what I could to say in my Slagle lecture that could inspire others. And that was called Promoting Occupational Therapy Through Words, Images, and Actions. Another pivotal point in my career was being a Fulbright scholar in Iceland, and that helped broaden my international perspective on how different cultures approach health and work and learning, and that permanently changed. That was 21 years ago. Permanently changed my global perspective and how I think, how I teach, how I advocate. And another was the founding of the Work Journal, a journal of prevention, assessment, and rehabilitation in 1990, in its 36th year. And that taught me to, if there was something you were thinking about and that you had an idea, to not be frightened to go forth with that. And I look back and say, I thank Gary Kielhofner, who introduced me to a publishing company that was looking for journals. And I pitched the journal and they accepted it. And it has really, grown and added to the evidence literature. But one part of my career that I'm excited about on a very, very personal level that I'd like to share is that my oldest daughter, Layla, is an occupational therapist and a great clinician. And her daughter, my granddaughter, Sophie, has decided to become an occupational therapist as well. And she just graduated high school. She's going to start in a state school in Connecticut in health sciences that should lead to a master's in occupational therapy. And we're just so proud that 3 generations of women have found their calling in occupational therapy.
This is wonderful, a wonderful journey, very inspiring. And this one last sentence that you mentioned about the three generations, that's very lovely and inspiring. And just a beautiful story to learn about, and it makes you also think about the human connection and how important it is to have others as professionals, but especially also having them, and how lucky for your daughter and also for your granddaughter to have you and to be within the family and to be inspired by such an OT. And I'm going to ask you another thing, which is related to human connection and our professions. So we know that OT is deeply human centered, and we focus always in the humans first. So, as healthcare continues to evolve through technology and digital transformation, what do you believe should remain unchanged about our profession?
Yeah, I love that question. It's the therapeutic relationship. Occupational therapy is built on the relationship between the occupational therapy practitioner and the client, and that is truly what will need to always stay. We want to always make sure that our clients feel truly seen, heard, and partnered with. No technology is going to change that. That therapeutic use of self as an occupational therapy practitioner is key. We are not replaceable by any technology. Technology may help us get our documentation done quicker, maybe be more efficient, gather evidence-based articles through, a search of the literature, but nothing will replace that human interaction, that therapeutic relationship that we establish with our clients.
So, for the clinicians that worry that technology may replace human connection, how do you see this relationship between innovation and then therapeutic relationships coexisting?
I love that question too. I see them as deeply complementary to each other. And let's do like a little example. Technology should be sort of the instrument, not the musician. And you can think about a well-designed digital tool might free us from, again, some maybe administrative burdens, so that we can spend more time with our clients, listening, observing, building trust. The risk isn't that technology replaces the connection, it's if we allow it to. That's a human choice. And we are distinctly equipped to make the right decision. That human connection is part of who we are, and technology will never replace that.
And to look at the other side, what opportunities do you see that AI creates for occupational therapists? Maybe something that we miss to see, focusing always in the fear or in the parts that maybe we will lose something, but what we can win from AI as occupational therapists.
I love that question as well. AI is here to stay. It's not going away. But the opportunities with AI are exciting. AI can help us with documentation, freeing clinical time that I mentioned previously. It can support screening and outcome tracking. It can help us reach underserved populations through the telehealth and digital tools. We can see it expanding our reach and opportunities to work with so many different clients. But there are real risks. We must be vigilant about the algorithm bias. AI has been trained on non-representative data that can perpetuate health disparities. It might reduce them in some ways via AI, but they may not really have happened. We need to guard against making decisions based on exactly the data that we're getting if we prompt and get a search. We have to always be diligent in checking everything. AI, I believe, will never replace our judgment. It will support it. But we have to make sure we understand data privacy, especially when working with any population. We can't be passive consumers of AI tools. We need to be critical evaluators and actively shape how they're developed. So it's not enough for us to get a GPT and use that, or to get a tool that's now been designed that may be effective for us in documentation. We should be diligent in reaching out to companies with our ideas, reaching out to companies to see if perhaps we can work with them to design tools that we can use that will be beneficial to the people we serve. So it's just not using the tools, it's helping to create them as well.
And if a newly graduated occupational therapist would ask whether they should embrace AI in their practice, considering it's the beginning, or if they should avoid it, what would be your advice for this? So, should they start right away since it's the new generation? AI is already present. Should they start incorporating that in their practice? Or should they avoid it in the beginning and just focus first in the practice and then try and integrate AI later on their journey?
They need to embrace it. They need to embrace it with their eyes wide open. I believe that occupational therapy practitioners who will thrive in the next decade are those who understand these tools well enough to use them wisely and to push back when they're being used poorly. And I mentioned some of that previously. Avoidance isn't going to make AI go away. It just means that someone else will make decisions for you and your clients. Don't let technology happen to you. Happen to technology. And I introduce AI in the courses that I teach at Boston University. And in fact, encourage my students to use AI, not to do all of their assignments, use it as a thought partner, use it to help maybe expedite some ideas that you might have had, but just can't, focus exactly on what you want. But understanding what tools are out there and what can be used is really important. I don't suggest students saying, no, I'm not going to learn anything, because when they get to the workplace, AI is there already. And so having some understanding is really going to help them better meet the needs of the clients and the places that they're working.
Thank you. And I was thinking about whether AI would help us become better clinicians or just faster clinicians. So what's your take on that? Is it only making our work faster, or is it also contributing in the content work that we're doing?
Yes, that's really important to take into consideration, because we hear a lot about, oh, AI is going to speed up everything that we do. Speed without quality is really not what we're looking for. But imagine an AI tool that helps a new clinician recognize patterns in assessment data that they may have missed, or one that flags when a client's reported occupational performance has declined in ways that warrant a proactive reach out to the client. That makes us better. It doesn't make us necessarily faster clinicians. And so I don't recommend that a occupational therapy practitioner say, I'm much faster because of AI. I would use it and say it's a tool that helps me be, in some ways, even a better clinician.
And considering this, what we're discussing about AI and technology and everything that we have and we are embracing, what skills do the future generation of occupational therapists need to develop that maybe the previous generations we didn't have it? Or how do you envision that occupational therapy will evolve in the next decade?
Yes. Well, I'm going to give you a couple of skills that I think are really important. Critical digital literacy is now very important. That's the ability to really evaluate technology, understand its limitations, and advocate for ethical and responsible use. That's really important. Cultural humility has always been essential, but I think it becomes even more as we work with increasingly diverse and global contexts. And, even your podcast is going to reach people around the world, and people that, if I was just interacting with just in my own world, I may never have reached. And I compliment you for reaching out and starting this podcast. Systems thinking, understand how policy, environment, technology, and occupation intersect will define, I think, the next generation of occupational therapy leaders. I see us moving towards, in some ways, maybe greater specialization in digital health, aging in place technology, because we see a very large generation, myself included, baby boomers aging and wanting to stay and live in their own contexts, and technology can be very helpful. And then mental health. These are just such important areas that we need to look at, community and primary care settings. And then I'm going to throw something in that I share in my class. I believe that students need to understand finance as well. And so financial literacy, understanding, the cost of their services, what's being billed for their services, and understanding perhaps maybe they want to start their own business, being entrepreneurial, which I do encourage occupational therapy practitioners to do. Financial literacy is key.
That's wonderful. Thank you for sharing. And I definitely agree. And it's really interesting to know that as profession, we are definitely in the leading position. You also mentioned the leaders of OT, and then it makes me think, are there something that we're missing to be included? Is there something that we can take a leadership role in the whole system rather than just waiting for policymakers or the healthcare system itself or the technology companies to make these decisions for us? Because when we get educated and trained and as how we think as OTs, it's not that we ignore these parts. It's not that we have no information in this, but then are we lacking something in taking this role? So do you have an opinion in this, what we can do better if we need to do something better? And I guess it's the same across all the world in different countries, but it's the same situation. OTs are more waiting than taking the leadership roles.
No, I agree with you, and I'll keep focusing on AI. Everywhere that AI touches practice and policy, we need to be there. We can't wait for tech companies to design, for example, rehabilitation tools without us. We can't wait for another example would be a hospital system to decide on how AI documentation works without our clinical voice at the table. We can't wait for policymakers to define telehealth reimbursement like we're seeing in the United States without advocating for our clients' needs. Our profession has a long tradition of advocacy. We need to develop that voice. Every single occupational therapy practitioner, and I challenge students, need to be comfortable with defining occupational therapy and advocating for it, or someone else is going to advocate their profession in roles that we have the skills and knowledge to be in. And I think about long traditional advocacy that in particular I've been very lucky to be part of, which was our backpack safety. It is the longest running public health initiative in occupational therapy. And we are the leaders in promoting backpack safety. And that's something that has been embraced by WFOT. So on World Occupational Therapy Day, every October 27th, we encourage people to participate in backpack safety. And so you can check WFOT on this international initiative.
That sounds amazing. And through your whole career, you have mentored and taught and inspired countless professionals. How does it feel knowing that this many clinicians around the world look to you as a source of inspiration and guidance? So, what responsibility comes with being someone so many people admire, learn from, and also get guidance from? So, what's the feeling and what are the responsibilities that come along with this?
Sure. It is humbling beyond words, and it can actually bring tears to my eyes. I don't take it lightly for even a moment. I think the responsibility is to remain honest, to share not just the wins, but the struggles, the uncertainties, the times that I got things wrong, the lessons learned, and how, to recalibrate. The people who inspired me were the ones who showed me that leadership is a practice, not a destination. And I hope that what I model in my own life and what I share is really important, that people see that they can help others find their voices, not echo mine. So I hope that people maybe learn from my lessons learned and find their own voice, to not be frightened to try. I think that's really important. There's so many times that I can reflect on things that I've done in occupational therapy that were totally outside of my comfort zone. But I pushed myself, and sometimes it worked and sometimes it didn't. But trying, I think, is important, and finding your own voice and starting when you're a student or any time in your career.
That's very beautifully said, and it's a small thing, but it makes me also think about the time that I decided to go and to study occupational therapy. I was very young. I just came out from high school. Occupational therapy was still a very new profession here in our place, so I didn't much know many occupational therapists. I was searching online, I was reading, I was seeing some role models, and I was thinking, can I be this good? Can I do everything that an OT does? Or am I the right person to do this? But I guess it's just this desire one. And then once I started, I just realized that it came more naturally to have all these informations and to embrace the training and to then follow that. So it definitely made me go back to that because I was definitely also questioning if I'm good enough to even start it. To what if I start and then I'm not good enough, and then at some point I also considered dropping it, but then once you learn more and everything gets integrated and you see people doing and practicing and learning from others that have more experience in this, it's always very inspiring.
Well,
That's one.
I'm glad that you stayed inspired and stayed in the profession.
Yeah, thank you so much. And yes, I'm as well very, very glad that I continued. So I would ask now, uh, about new students that are in the early career or maybe just beginning to study, as I was years ago, and that they will be listening to this conversation. So, what advice would you give to someone just beginning occupational therapy journey?
Oh, I love this question. Stay curious. Be a lifelong learner, not because the field demands it, but because your clients deserve it. Find your niche, find your passion. Uh, don't be sort of in a box. Build relationships with mentors, with peers, with people of other disciplines. Think about interprofessional practice. Don't be frightened if you read a journal article or a chapter in a book and there's something that that author wrote that resonates with you. Reach out to that person. I encourage my students to do that. I do it as well. Those are really important things on this journey. I think put yourself in rooms that may be uncomfortable. Like I said, there's many times in my career that I probably didn't belong, but I asked to be there. And so I think that curiosity, that advocacy, knowing that you're there to represent the people you serve can be a big motivator.
And do you have something that you wish someone has told you when you were at the start of your career?
Yes. I guess I wish someone would have said to be less afraid to try things that might not work out. You know, just at the beginning of my career, I think that every misstep, like I said, lessons learned was really important. I guess I wish that someone had said, trust my instincts sooner. And, you know, that even when I was in a room full of people with different credentials and more apparent authority, that I did have my voice, just like I was sharing. I was, not knowledgeable to see whether or not the things that I was thinking would be valued. But I did do something when I was a student, and I didn't share it with the professors. I set goals for myself, and they were very grandiose goals. No one told me to do it. And so I want to impart that I'm advising your listeners to set goals for yourself. And they can be stretch goals. So let me tell you what mine were. And at that time, I think if I had shared it with some people, it was a different time. The 70s were very different than what we're living in now. One goal was to write a book. I didn't know what I was going to write about, but I knew that there was something that I could see that there was something in occupational therapy that was missing, and that perhaps I would find what it was through, just my job, reading, that maybe I could write about. The other thing was I wanted to become a fellow of the American Occupational Therapy Association, all those letters, FAOTA. I wasn't sure how I was going to get there, but I wanted that as a goal. I saw many people with that after their name from journal articles or chapters that I read, and it seemed like they gained respect by having, those credentials. And then, as grandiose was to be president of the American Occupational Therapy Association. And I can say I've been very lucky to have reached those goals. And as I proceeded my career, I realized that those were important goals, but there were so many more that were steps to get there that I needed to achieve.
That's wonderful and wonderful advice, but makes me think of another thing. How can young professionals, when they are maybe in this period to setting goals and aspiring to do something, how can they stay optimistic during this time? And maybe there are some rapid changes or something that is coming that is not certain, or how can they stay optimistic in this all unknown journey that they have goals, they know that they want to achieve something more, but how is this journey, or maybe how was yours? How can they manage this until they reach to the goals?
Yes, and you're asking a really important question. There is a lot going on in the world, um, that can impact our lives, not just our work life. So I always say, and I practice this: anchor yourself in why you chose occupational therapy. When you listen to the news or the radio or read a headline in a newspaper about what's going on in the world, and you start feeling overwhelmed and the systems seem broken, go back to a single client interaction that reminded you why this work matters. That client that said, I can now take care of my grandchild because you worked with me in occupational therapy. That's just sort of an example. That's your compass. Find your community, people who share your values and your passion. And that's always been really important for me. I have occupational therapy friends that start out as my colleagues. Some are mentors, and I mentor them back and forth. Optimism to me isn't naive, it's a practice. Stay optimistic. It takes tending. Surround yourself with people who tend it alongside you. Stay optimistic. Anchor yourself over and over again in why you chose the profession.
That's wonderful. Thank you. This one last question is, and I mean, your answer was something that I would love to hear on repeat, and maybe also the people who will listen to this podcast. It's something that's very inspiring and very helps you ground and see the good part and makes this planning of our journey, our profession, our career seem more doable. And even though we do this for everyone else, it's still harder when we try to do it for ourselves. So it's always very helpful to hear this from someone who has walked this journey, who has been there, and who did it. So thank you that you shared this with me and everyone who will listen to this conversation.
Oh,
And
great.
we slowly are coming to the end of this conversation, but I do have some last questions that I'm going to call them the speed round. So
Okay.
there are just some questions that can be answered with short sentence or one word or just direct question and answers that I would love to have in our discussion. So the very first one is if you would describe occupational therapy with one word, what would it be?
Transformative.
I love it. And what is one book that has influenced your thinking, maybe that you would just highlight from the others?
Sure. Dare to Lead by Brown, because it gave me sort of a framework that vulnerability is not a weakness in leadership, it's a source of courage. And her work validated the kind of leadership I aspire to be, one that's built on trust, honest conversation, and the willingness, and this is something really important, and I struggle with this, and hopefully someday I will be comfortable with it all the time, willingness to sit with uncertainty.
And what is one daily habit that contributes to your success?
Um, Curiosity with intention. And I try to start the day asking what I might learn today. And I do have to say, I'm going to add a couple more. One of the things that's really helped me in my career is my time management and organizational skills. And that's really important. And I would encourage um, your listeners to think about that as something to work on if those are not skills that are part of who they are.
And the very last question is one thing that every healthcare professional should never stop doing.
And I think this is important as a human being, listening, not waiting to speak, but actually listening.
That's wonderful. This all has been a very insightful session. I enjoyed it very much. I feel very privileged that I got to do this conversation and to make these questions and to learn more directly from you. And I just have to say once again, thank you so much that you dedicated this time to share this knowledge with all of us and to be once again an inspiration for all the health professionals, but especially for occupational therapists.
Well, thank you for inviting me. This was so enjoyable. I love the questions that you created. They really were insightful. And perhaps other people will take those questions and reflect on them for their own careers. So thank you. Thank you for your leadership.
Thank you so much. It's my pleasure.
Thank you for listening to this episode. We hope you feel more ready, set, and connected. For more, visit ReadySetConnect.com.